Shortness of breath. Could it be a misdiagnosis for lung cancer? Have you ever wondered if shortness of breath could be misdiagnosed as lung cancer? This is a common concern, as shortness of breath, also known as dyspnea, is a symptom that many people experience. While it is recognized as a symptom of lung cancer, it is not specific enough to confirm a diagnosis on its own. In fact, shortness of breath can be linked to various other lung and heart conditions, such as asthma, chronic obstructive pulmonary disease, pneumonia, pulmonary embolism, and heart failure. When it comes to lung cancer, the symptoms often overlap with those of other respiratory illnesses. This can make it challenging for healthcare providers to accurately diagnose lung cancer based solely on symptoms. Research indicates that while shortness of breath is associated with lung cancer, its diagnostic accuracy is moderate. Studies show that the area under the curve for this symptom is around 0.65, meaning it is not highly reliable for diagnosing lung cancer by itself. Because of this symptom overlap, lung cancer can sometimes be misdiagnosed as other more common conditions. For example, a patient experiencing shortness of breath might initially receive treatment for chronic obstructive pulmonary disease or pneumonia, without lung cancer being considered. This highlights the importance of thorough diagnostic procedures that go beyond just assessing symptoms. To definitively diagnose lung cancer, healthcare professionals typically relying on imaging tests, such as low-dose computed tomography scans. These scans provide detailed images of the lungs and can detect small tumors that may not be visible on standard X-rays. Additionally, tissue sampling through biopsy procedures, like needle biopsy or bronchoscopy, is necessary to confirm the presence of cancer cells and determine the specific type of cancer. It is also important to note that early lung cancer often does not cause noticeable symptoms, or symptoms like shortness of breath may only appear when the disease has advanced. This further complicates the ability to diagnose lung cancer based solely on symptoms. Therefore, screening in high-risk individuals, such as long-term smokers, is crucial. Low-dose computed tomography scans can help detect lung cancer earlier than relying on symptoms alone. In summary, while shortness of breath is a common symptom in lung cancer, it is nonspecific and shared with many other lung and heart diseases. Relying solely on symptoms for diagnosing lung cancer has limited accuracy, and misdiagnosis can occur if symptoms are attributed to other conditions without appropriate imaging and biopsy. A definitive diagnosis requires imaging, preferably low-dose computed tomography, and tissue biopsy. For those experiencing persistent or unexplained shortness of breath, it is essential to seek a thorough medical evaluation, including appropriate imaging and consultation with specialists, to rule out lung cancer or other serious conditions. This approach aligns with current medical guidelines and emphasizes the importance of lung health management.